I'm Dr. K.A. Reddy from LBR Dental and Implant Center. We have our medical facility in Hyderabad, India. So we do dental tourism from where patients from US, Australia, United Kingdom, and apart from these three major countries, Australia, US and UK, we also get patients from Canada and the Middle East countries and New Zealand too. So most of the patients, they prefer Zirconia. The reason for making videos is I want to give you specific details on how we do Zirconia on All-on-6. So there are basically two types of implants which are being used, especially in India, basal implants and the conventional implants. So basal implants are single piece implants, whereas the conventional implants are the two-piece implants. The basal implants are not US FDA approved, so I would warn all the international patients who are coming on dental tourism to India not to opt for a basal implants. The reason being, these implants are not approved in your own country. So in case if you have any problem with the implants, your local doctor will not be able to attend on you. So I would recommend you to opt for implants which are being used in your own country, native country. So that's the reason we use only conventional implants with a screw retained teeth. So I have developed a technique called a CPBCCI Protocol. So in this CPBCCI Protocol, it is called crystal polished bicortical conventional implants. So the reason being, the conventional implants, they are normally placed in a soft cancellous bone. So they cannot load immediately. If you ask any dentist in Australia and US, they say, no, we'll place the implants now, but we'll load the teeth after 4 months. And sometimes they do sinus lifts, bone grafts, and the whole process might take 6 months to 8 months. Whereas following this CPBCCI protocol, where we use crystal polished implants, these implants are mainly from Norris Medical Systems. So these are US FDA approved implants, which are being also, there are a lot of practitioners who are practicing Norris implants in US. So I use Norris Tough Pro. These are special design implants. Majority of the implants even I consume here in India. So I use a Norris Tough Pro implant. So along with this, there are other implants which are also crystal polished. So these implants, what I do is I engage the cortical bone. So instead of the soft cancellous bone, we engage the cortical bone. That's the reason I called my trademark protocol as crystal polished bicortical conventional implant. So with this protocol, you can load teeth immediately. So here now coming to the teeth aspects, now we have fixed the teeth on implants and the teeth are fixed in a 1 week period, maximum 1 week period. So you need to plan to come for 10 to 12 days time. So if you are planning to come to India for dental tourism, especially most of the patients come for full mouth rehabilitation. So do plan to come to India for 10 to 12 days. So majority of the patients, they prefer Zirconia teeth. There are other types of teeth which are available and we deliver to the patients, which are DMLS metal ceramic teeth, and there is a PEEK material which is also being used. Graphene is also being used, but these are all very soft materials and there is a tendency to break. And Zirconia, normally it is said that Zirconia is a very hard material, it won't break. But if you opt for a Zirconia, plain Zirconia without any titanium frame support, that means you should have a metal support over which Zirconia teeth can be fixed. Now if you look at this teeth, this is a beautiful Zirconia teeth. There is absolutely no ceramic at all. This is a solid Zirconia from here to here. This is a solid Zirconia, and the bottom portion is stained in a pink color. Even this is a Zirconia, but it is stained in a pink color. Okay, so the reason why I'm making a video is, if you turn the other side, okay, if you look from the top, it is like this, but in the bottom side where it, where it is fixed to the implants, these holes, if you can see, these are the screw retained holes where we put screws and then tighten to the multi-unit abutments. So if you look at the other side, you can see this is metal. What you see is a titanium frame. So in a clinical scenario, in the patient's mouth, they cannot see the metal frame because it goes and fits on the gum like this. Okay, it fits onto the gum like this. But if you turn upside down, they can see the metal frame. The reason for giving the metal frame is this titanium frame, which is very light in weight. So this will help prevent breakage of the zirconia. If you opt for a zirconia teeth, without titanium frame, I'm sure you will going to have a problem. So it will break sooner or later. It is going to break. So I want to warn all the international patients who are coming for a dental tourism to opt for a zirconia teeth with titanium frame. So LBR Dental and Implant Center is the only hospital which is giving you this titanium frame, over which we are giving a solid zirconia, and we are not giving any ceramic because ceramic will break. So the zirconia teeth, opt for a zirconia teeth over the titanium frame. And if you say like, no, my dentist has said the zirconia is very hard, it won't break. Yes, it won't break. Zirconia won't break. But what happens between the implants? When you have two implants here, so now there are two implants here, the zirconia over here between, if you see the zirconia between the two implants, the zirconia is the weakest. So wherever the implant is there, the zirconia won't break, but in a space between the two implants, there is the tendency for it to break. So I would suggest and I would warn all the international patients not to opt for zirconia without a titanium frame. Okay, thank you so much.